So good day everyone. Today, our group will be discussing one of the most important systems in a human body, and that is the reproductive system. So as we all know, the responsibility of the reproductive system is to produce offspring. Also, it is the one who ensures the continuation of life. However, it is not the only role it plays, but it also helps in maintaining the hormonal balance and overall body development. Now, the main objectives of this discussion is to help you all understand and appreciate how life begins and how to protect our reproductive health, which is essential for our overall health being. Now, without further ado, let's move on to the key functions of the reproductive system. So the first function of the reproductive system is the production of gametes. So clearly, from the word itself, production of gametes. So, it is the production of gametes, yes. And we all know that the gametes of female and male are the one who took responsibility for producing the offspring. Now, for the gametes in male, we have the sperm cell, and while in the female, we have the egg cell. Now, these two plays the important role in producing an offspring. So clearly, the reproductive system is the one who is responsible for the production of the gametes. And then the next function of the reproductive system is the fertilization. So we all know that the fertilization happens when there is a fusion of the sperm and the egg cell, which is what we call the gametes or the sex cells. Now, the key function of the reproductive system in fertilization is that it enhances the fertilization of the oocyte by the sperm until it matures, and then it is deposited into the female reproductive tract by the penis. Later on, we will gonna explore the different explore the anatomy of the reproductive system of both male and female. Also, we will gonna explore the physiology on the next video. And then, for the continuation, yes, the reproductive system is the one who enhances the fertilization of the oocyte by the sperm until it matures and then deposited into the female reproductive tract by the penis. Now, when the female reproductive tract receives the sperm cell, it will then transports into the fertilization site, which is the uterus. And then the third function of the reproductive system is the development and nourishment of a new individual. So, the reproductive system is the one who nurtures the development of the new individual in the uterus. So, from the word nurture, so it is the one who will provide support, nutrients, the needs of the new individual in order to sustain its development and until it will gonna go outside the world, which is the main function of the reproductive system. And then lastly is the production of reproductive hormones. So these reproductive hormones are very familiar to us. So the LSH, the follicle reproductive hormone, the gonadotropin, the prolactin hormone, which is responsible for the milk production, and then many more reproductive health. Now, these hormones are essential for normal function of the reproductive health and the reproductive behavior of a human being.
So, I am Mark Henry Tapimpernia, and my part is to explain to you the male reproductive system. The male reproductive system includes the testes, ducts, glands, and supporting structures. The testes in the scrotum produce sperm at a temperature lower than the body heat. Sperm travel through the ductus deferens to the prostate. then into the urethra, which passes through the penis to exit the body. So basically, male reproductive system is the male reproductive organ, which have a scrotum, a testis where the sperm reside, the ducts, the glands, and of course the urethra, the exit way of the sperm and the urine. So first we are going to explain the scrotum. The scrotum is a sac that holds the testes and is divided into two compartments. It's made of skin, connective tissue, and smooth muscle called the dartos muscle, with cremaster muscles extending from the abdomen. These muscles control testicular temperature for normal sperm development, contracting in the cold to pull the testes closer to the body and relaxing in warmth to let them hang lower and stay cool. So basically, the scrotum is divided into two compartments, which is have the made of skin, a connective tissue, and smooth muscle. Smooth muscle are called the dartos muscle, and with another muscle called the cremaster muscle. When we say dartos muscle, during the cold temperature, the dartos muscle, which are composed of made of skin and connective tissue and a smooth muscle, will shrink, and the cremaster muscle will pull up. So for those men who can picture out this one, during cold temperature, the testes or the scrotum will be shrink, and those egg will be near in our intestine. But during the high temperature or warmth, the testes will be in relaxed form, which says that the testes will be distance away in our intestine, and our dartos muscle will be in loosen up, which will in warm temperature. So next is the testes. The testes are oval organs about 4 to 5 cm long, located in the scrotum. Each is covered by a tough connective tissue capsule that divides it into around 250 lobules. Each lobule contains seminiferous tubules where sperm develop. Between the tubules are interstitial or Leydig cells that produce testosterone. Inside the tubules, sustentacular or Sertoli cells support and nourish developing sperm and secrete hormones. So testes are oval organs that is 4 to 5 cm long. Within is located inside the scrotum. Each covered with a connective tissue capsule and divides into 250 lobules. Katong 250 lobules contains a seminiferous tubules where ang sperm na develop. Ang 250 lobules contain a seminiferous tubules where a sperm develop. Within these tubules is the Leydig cells. The Leydig cells is responsible for producing the testosterone. And inside the tubules are the sustentacular or the Sertoli cells. Sertoli cells also will be supporting and nourishing the development of our sperm and the secretion of the testosterone hormones. This is the function of our testes. Next is the spermatogenesis. Spermatogenesis is the process of sperm cell formation. Before puberty, the testes are inactive, but at puberty, interstitial cells enlarge, seminiferous tubules grow, and sperm production begins. Germ cells called the spermatogonia divide by the mitosis. Some remain as spermatogonia, while the others develop into primary spermatocytes that undergo meiosis to form sperm cells. So our spermatogenesis is a process of sperm cell formation. When we say spermatogenesis, it is the process of the sperm cell formation. Before puberty, the testes are inactive, but at puberty, interstitial cells katong ingon nga nay lobules. Then within that lobules, there are 250 tubules. That is the seminiferous tubules. That is the storage or the development of the sperm. As little go, as well the sperm production begins. So dira na makita po ang spermatogenesis. Sperm cells called the spermatogonia Ang spermatogenesis nag-undergo two division, which is the mitosis and meiosis. Mitotic division and meiotic division. Ang germ cells called the spermatogonia divide by mitosis. Ang uban remain spermatogonia para na mag-undergo gihapon para maka-produce of sperm cell, while ang other will be developed into primary spermatocytes. So basically 46 chromosomes divide siya mitosis into 23. This one will ang other half will undergo into another spermatogonia, then ang isa will be developing into primary spermatocytes that will undergo a meiosis to form a sperm cells. So ang isa kay nag-undergo spermatogonia para naibigay pa yung development develop ka po ito primary spermatocytes that will undergo meiosis to form a sperm cells. Pero ang kaning isa will be magpadayon niya po siya develop into primary spermatocytes to undergo meiosis to form a sperm cell. Ducts after their production, sperm cells are transported through the seminiferous tubules and series of ducts to the exterior of the body. Basically, the ducts is the pathway lang sa mga sperm. Epididymis, the seminiferous tubules connect to a network called the retitestis, which leads to 15 to 20 efferent ductules that carry sperm to the epididymis. In the epididymis, sperm mature, gaining the ability to swim and fertilize an egg. Sperm from the testes cannot fertilize until these spend several days maturing in the epididymis. Their final activation, called the capacitation, happens after ejaculation inside the female reproductive tract. So epididymis, the seminiferous tubules connect the network called the retitestis, which leads the 50 to 20 efferent ductile carry sperm to the epididymis. So ang epididymis and seminiferous tubules daw kay connect siya sa network called the retitestis, which leads the 15 to 20 efferent ductiles na nag-carry og sperm pasol sa epididymis. Sa epididymis, ang sperm mag-mature. Ang sperm mag-mature dito, mag-gain siya og ability, makabalo siya sa epididymis siya, makabalo mo swim og mag-fertilize on egg. Sperm from a testis, ang sperm mo gikan sa testis is cannot fertilize. Ang sperm na from the testis cannot fertilize kundi sila mag-undergo several days nga maturing dito sa epididymis. So kailangan pa gyud mo agig epididymis para ma-mature ang sperm na makagain siya ability to swim and maka-fertilize on ang egg. Their final activation called is capacitation. Happens na siya capacitation during the ejaculation inside the female reproductive tract. Next is the ductus deferens. The ductus deferens or vas deferens carries sperm from the epididymis and joins the blood vessels and nerves to form the spermatic cord. Each cord includes the ductus deferens, testicular artery and veins, lymphatic vessels and nerve, all surrounded by muscles and connective tissue. The ductus deferens passes through the inguinal canal loops behind the bladder and widens into ampulla near the prostate. Its smooth muscle walls move sperm forward through the peristaltic contractions. So basically, the ductus deferens kana lang ang pathway sa pagsulod sa sperm from epididymis na mo join sa blood vessels and nerve from the spermatic cord. So next is the seminal vesicle and ejaculatory duct. Each ductus deferens has a nearby sac-like seminal vesicle. A duct from the seminal vesicle joins the ductus deferens at the prostate to form the ejaculatory duct, which passes through the prostate and opens the urethra. So, ang seminal vesicle, each ductus deferens kaya nasa isa-isa na dool nga sac-like seminal vesicle. A duct from a seminal vesicle joins the ductus, mag-join sa ductus at the prostate to form the ejaculatory duct, which then after that form sila sa after the ductus deferens after seminal vesicle join the ductus deferens at the prostate gland, sa prostate sila mag-join to mag-form na sila ejaculatory duct, which passes through the prostate and opens into the urethra. The next is the urethra. The male urethra runs from the bladder to the tip of the penis and has three parts: the prostatic urethra, membranous urethra, and spongy urethra. It carries both urine and semen, but a reflex prevents from the passing at the same time by closing the internal urinary sphincter during ejaculation. The male urethra runs from the bladder at the tip of the penis and has three parts, which is the prostatic, membranous, and spongy. So ang urethra ang agianan sa urine o sa semen, but dili na sila magsagol because through reflex ma-prevent niya ang passing sa urine o sa semen at the same time. Ma-close niya ang internal urinary sphincter during ejaculation. Tungod sa reflex, ma-close niya ang internal urinary sphincter during ejaculation. That's why ang semen ray mo gawas, dili ang urine. The penis. The penis is the male copulatory organ that transfers sperm to the female. It contains 3 columns of erectile tissue, 2 corpora cavernosa on the dorsal side, and 1 corpus spongiosum on the ventral side. So there are 3 columns of erectile tissue, 2 ka corpora cavernosa on the dorsal side and isa ka corpus spongiosum on the ventral side, which surrounds the urethra and forms the glands. Erection occurs when the erectile tissue fills with blood. The penis is covered with the skin, with the glands often protected by the prepuce or the foreskin, and is richly supplied with the sensory receptors. The penis is the male copulatory organ, the main organ na makita yun visible sa tawo. Ang penis na mao na makatransfer the sperm to the female organ, and it has ang erection di ay mahitabo na siya when the erectile tissue. Ang erection occurs when the erectile tissue is filled with blood, mapuno og blood ang erectile tissue, mao nang na erection mahitabo. And the penis is covered with the skin with the glands often protected by the prepuce called the foreskin, and it is richly supplied with the sensory receptors. The glands. The seminal vesicles are 2 sac-like glands, which glands next to the ampulla of the ductus deferens. Each connects to the ductus deferens to form the ejaculatory duct. The prostate gland, about the size of walnut, surrounds the urethra and ejaculatory duct. It has glandular and muscular tissue, secretes prostatic fluid, and delivers it to the urethra through 10 to 20 short ducts. The bulboretral glands are 2 small mucus secreting the glands near the base of the penis. Each has a duct that empties into the urethra. They are about the size of a pea in adults and shrink with age. The glands. Secretion. Dili na ni. A secretion, it is the semen na ato na masulod na sa female organ. Secretion. Semen is a mixture of sperm and fluids from male reproductive gland. Seminal vesicles 60%, prostate 30%, testes 5%, and bulboretral glands 5%. Mucus from bulboretral and urethral glands lubricates the urethra, neutralizes acidity, aids intercourse, and reduces vaginal acidity. So di ay a seminal vesicle nasa 60% from prostate and semen. Ang mixture na siya semen, mixture of sperm and fluid, 60% sa prostate, 30% sa seminal vesicle, 60%, 30% sa prostate, testes 5%, bulboretral glands 5%. Mucus from the bulboretral and urethral glands lubricates the urethra, neutralize siya sa acidity, the aids intercourse para dili sakit, and reduces vaginal acidity. Testicular secretion includes sperm and small amount of fluid. Seminal vesicle fluid is thick and contains first fructose, nourishes the sperm. Number 2 is coagulation proteins, taken the semen to keep sperm in the vagina. Third is the enzymes, help remove abnormal sperm. Fourth is the prostaglandins, stimulate female tract contractions to aid sperm movement. So it is very very understandable, so no need to explain. Prostate secretions are thin and milky with two main functions. By regulate pH level, they're alkaline. Prostate secretions are thin and milky with two main functions. First is to regulate the pH level. Their alkaline nature neutralizes acidity in the urethra, semen, and vagina, allowing sperm to swim at optimal 6 to 6.5 pH level. Liquefy semen. Enzymes break down coagulated proteins from seminal vesicles, freeing sperm to move toward the oocyte. Normal semen volume is 2 to 5 ml, containing about 100 million sperm per milliliter. That's all for the male reproductive organ system.
So next is let's proceed to the representative disease and disorder of reproductive systems. So there is several conditions and descriptions. So the first condition is pelvic inflammatory disease. So this disease is a bacterial infection of a female pelvic organs, commonly caused by a vaginal or uterine infections with a bacteria called gonorrhea or chlamydia. Early symptoms include increased vaginal discharge and pelvic pain. Antibiotics are effective if untreated early and can lead to sterility or be life-threatening. Next is sexually transmitted infection or STI, commonly known as STI, spreads by intimate sexual contact. So first in the list is the non-gonococcal uretinitis. So when we saw the word uretinitis, it's an inflammation of the urethra that is not caused by this is not caused by a gonorrhea and can be caused by a trauma or insertions of a non-sterile catheter or sexual contact, usually due to the infections with a bacterium called Chlamydia trachomatis. So these infections may go unnoticed and results in a pelvic inflammatory disease or sterility. Antibiotics are effective treatment. Next is trichomoniasis. So this infection caused by a trichomas. So the infection caused by a trichomas, a protozoan commonly found in the vagina of women and in the urethra of men, results in the greenish yellow discharge with a foul odor, more commonly in women than in men. Next is gonorrhea, caused by the bacterium Neisseria gonorrhoeae, which attaches to the epithelial cells of the vagina or male urethra and causes pus to form. Pain discharge from the penis occur in male. So these particular infections is asymptomatic in women in the early stages and can lead to sterility in men and pelvic inflammatory disease in women. Next is genital herpes. So this is caused by a herpes simplex 2 virus. First, let's know what is herpes simplex virus 2 known for causing. So, an estimated 520 million people aged 15 to 39, 13% worldwide have herpes. Most herpes. Simply virus type 2 or HSV2 infection, the main cause of genital herpes. Most HSF infections are asymptomatic. It means it doesn't show symptoms in early stages or unrecognized, but symptoms of herpes include painful blisters or ulcers that can reoccur over time. Virus characterized by lesions on the genital that progress into blister-like areas, making urination, sitting, and walking painful. So the most effective medication of this is antiviral drugs that can be effective. Next is syphilis, caused by a bacterium Treponema pallidum. Can spread by sexual contact or multiple disease stages occur. So, if the children born to an infected mother may be developmentally delayed, so the newborn may developmentally delayed if the mother is infected by the syphilis. So the most effective medications of this infection is medication such as antibiotics are effective. Next is the acquired immunodeficiency syndrome, or also known as AIDS. So in the Southeast Asia, the Philippines has the fastest growing number of HIV cases in Asia Pacific region. So every day this year, at least 57 Filipinos have found out they have HIV. The number of new cases of HIV went up by 550%, which is very alarming, from 4,400 into 2010 to 26,600 in 2024. Around 200,500 to 800 Filipinos are estimated to be living with HIV in 2025. Unfortunately, HIV is incurable. There is no currently or no effective cure. Once people get HIV, they have it for life. But proper medications care can control the virus progression. People with HIV who get on and stay on effective HIV treatment can live long, healthy lives and protect their partners. HIV, which ultimately destroy the immune system, transmitted through intimate sexual contact or by allowing infected body fluids into the interior of the person. Additionally, untreated HIV progress to AIDS, leading to greater risk of death from infections. Antiviral medications do not cure HIV, but they help people live longer and happier lives. The transmission of HIV is not only in sexual interactions, but through bodily fluids. For example, blood and milk from an infected mom can have a higher risk to infect a infant. Overall, HIV infects white blood cells, which is the immune cells of your immune system, called the CD4 cells or helper T cells. It destroys CD4 cells, causing your white blood cell count to drop. This leaves you with an immune system that can fight or cannot fight mild infections, even those that would wouldn't normally make you sick.
My name is Mary Joy Morales, and my topic is all about female reproductive system. Female reproductive system consists of ovaries, fallopian tubes, uterus, vagina, external genital. Ovaries are consist of two. Each ovary is anatomically positioned in the pelvic cavity that's supported by the two ligaments, the suspensory ligaments and the ovarian ligaments. The suspensory ligament extends from each of the ovary to the lateral wall, and the ovarian ligament attaches the ovary to the superior margin of the uterus. Ovaries are attached to the posterior surface of the broad ligament by a folds of peritoneum called mesovarium. When we say peritoneum, it's an inner layer that covers and encloses the internal organ. A visceral peritoneum covers the surface of the ovary. The outer part of the ovary is composed of dense connective tissue that contains ovarian follicles which contains oocyte or the female sex cells. Uterine tubes are fallopian tubes. Fallopian tubes is associated with each ovaries. It extends from the area of ovaries to the uterus. The opening of each tubes is surrounded by a long thin process called fembria. Contains cilia that could sweat down the oocyte released from the ovaries down to the fallopian tube. Conception occurs. The egg will be fertilized in the part near the ovary called the ampulla. The fertilized egg will then travels to the uterus where it embeds in the uterine wall in the process called implantation. Next is the uterus. Uterus is as big as a medium-sized pear. The part of the uterus superior to the entrance of the uterine tube is called the fundus. The long part is the body and the narrow part is the cervix. This continues to the cervical canal which opens into the vagina. The uterine wall is composed of three layers. The serous layer, or called perimetrium, the middle layer, the myometrium or muscular layer, and the innermost layer of the uterus is called endometrium. These three layers are supported by the two ligaments, the round ligaments and the broad ligaments. Weakened due to childbirth, the uterus will extend inferiorly to the vagina. So, mainat siya in which lead into a condition called prolapsed uterus. In rare cases, this condition requires surgical correction um, para mabalik ang uterus to its original position. Next is the vagina. Vagina is the female organ of copulation. It receives penis and allows menstrual cycle and childbirth. Muscular layer that contains many elastic fibers that could accommodate the size of the penis and can stretch during childbirth. In young females, the vaginal opening is covered by a thin mucous membrane called hymen. In rare cases, the hymen completely covers the vaginal opening, which requires removal in order to allow the menstrual flow. External genitalia, or also known as vulva, is consists of vestibule. Vestibule is the space of both vagina and the urethra opens. Outside the urethra is nasa ka ng skin fold, long, thin longitudinal skin fold called labia minora nga nagtagbo pud siya in a part called prepuce. Outside the labia majora, naa pud siya rounded fold skin nga gitawag og labia majora nga nagtagbo in mons pubis. Space between the labia majora is called the pudendal cleft. Then a region between the vagina and the anus is called the clinical perineum. Clinical perineum is composed siya of skin and muscles. So, in cases during childbirth, women is magisian siya diri nga region. The skin and the muscles of this region is naay possibility nga magisi during childbirth, especially kung dako ang baby. So, the incision called episiotomy is applied. This region called clinical perineum ang pagdako sa gisi. So, tahion siya diri nga part. Female breast consists of 15 to 20 glandular lobes. Each lobes possess single lactiferous duct that opens independently to the surface of the nipple. These ducts form several small ducts to form lobules. The end of these ducts expand to the called alveoli, and the mesothelial cells that surrounds the alveoli that triggers contraction to expel the milk. The milk will travel from the lactiferous duct to the nipple para padulong sa nipple. There is a condition called gynecomastia in which ang mga lalaki is permanently enlarged ang ilang breast. This condition is due to hormonal imbalance and the abuse of anabolic steroids.
Hi, good afternoon. I am Doreen Merle Satit and I'm here to present the physiological female reproductive system. So first, let's start with the puberty. So puberty in females start at the age of 11 to 13 and somehow completes at the age of 16. So menarche is called, it is a first episode of bleeding, so it is called menarche. And of course, during the puberty, there is these physical changes. So, of course, the enlargement of vagina, the uterus, the fallopian tube, the breasts and hips due to fat deposition, and also the growth of our pubic hair and also for the armpit hair. So during puberty, there are hormonal changes. It's because it is the rising of estrogen and progesterone which make changes and starts menstrual cycle. So next is the menstrual cycle, of course. So menses is a period of mild hemorrhage when the uterine lining shed. So it refers to the series of changes in sexually mature non-pregnant females that result in menses. So, the ovulation and phases, the egg release around day 14. So, hormone prepare the uterus for possible pregnancy. So, there are two, which is if no fertilization occur, the hormone drops and the next period begins. So, if fertilization occurs, the zygotes undergo cell division to produce collection of cell called blastocysts. And lastly is the endometriosis. Endometriosis is a condition where the endometrial tissue grow outside the uterus, which they call ectopic pregnancy. So it is not common problem to some women, but it is there are some pregnant women who experience in a case like this. So next is the menopause. So let's talk about the menopause. Menopause is the cessation of menstrual cycle. So at the age of 40 to 60 years old, become less regular nga dugon. So there this term which called the female climactic. It is the transitional period from irregular to menopause. So HRT, it is a hormone replacement therapy to treat symptoms like symptoms of having menopause like fatigue, emotional changes, anxiety, and etc. And also, it's not about just treat, but also protect the bone, and also may increase health risks. Of course, there are advantages and disadvantages in a therapy. So next, let's move on to the control pregnancy. So contraception is a method in preventing fertilization and implantation. So actually, there are 4 types of this kind of methods, which is the surgical method, the chemical method, the barrier method, and also the behavioral method. So first, let's start with the behavioral method, which they called abstinence and refraining sexual intercourse, or ang paglikay na lang yun sa sexual activity. So next is the coitus interruptus, which is called withdrawal. So it is the removal of the penis just before the ejaculation. So some of you know already about this. So number 3 is the natural family planning, to avoid intercourse when near ovulation. So some of a mother or a female use this kind of method, which they also call calendar method. So they will know when are they going to become fertile, when they are kano sa sila ovulate, and kano sa sila dugon. The next is the lactation. It is lactation amenorrhea. It is effective up to 6 months postpartum as long as the mother baby is breastfed. So next is the barrier method. In barrier method, first let's start with condom. So male condom is made up of animal membrane. So it is 98% effective. Next is the vaginal condom, which is the same with the male condom na i-insert gihapon siya sa sex organs sa female and male. So in vaginal condom, it is inserted in the vagina before intercourse. So it is 95% effective. The next is the diaphragm and cervical cup. It is placed over the cervix, preventing the sperm enters. So it is 94% effective. Next is the spermicidal agents. It is applied in the sex organ of a male na muna siya ang gamiton nga i-applied siya sa sex organ sa male to kill the sperm. So next is the IUD, which is called the intrauterine device. So gina-insert ni siya sa matris sa mama nato or sa female or any individual na i-insert siya para ang purpose sa IUD para mag-thicken ang cervical lining sa matris sa individual. So next is the chemical method, which is the oral contraceptives, which they call pills. So it is an intake pills to control pregnancy. So there are different kinds of brands of pills. So next is the Depo-Provera, which is the monthly progesterone injection. So gina-inject siya every month. And next is the vaginal ring. It releases hormone in the vagina. Next is the RU486. It is used to block the action of progesterone. So next is the morning after pill. So it is taken after intercourse. So before sila mag plan, when they plan to do something like that, the female will first do her thing na inumdaan atong morning pill. So, yeah, lastly is the surgical method. So, surgical method is number 1, the vasectomy. So, the ductus deferens of a male cut and tied in the scrotum. So, katong, I know there are some of you guys already familiar with the vasectomy wherein katong na siya i-cut sa below nga part sa penis sa male para dili na siya ka-produce og sperm. It is a lifetime procedure. So next is the tubal ligation, which is to block the sperm oocyte passage.
By the hypothalamus. The target is the pituitary. In response, it stimulates the secretions of LH or luteinizing hormone and FSH or follicle stimulating hormone. Then this hormone passes to the anterior pituitary gland. It causes the cells in the anterior pituitary to secrete two hormones, which is the LH and the FSH in the blood. So the luteinizing hormone, the source is the anterior pituitary. The target tissue is the interstitial cells of the testes. It responds to stimulates synthesis and secretion of testosterone, supports spermatogenesis, and inhibits secretions. While the follicle stimulating hormones, its source is the anterior pituitary, same as the luteinizing hormone. The target tissue is the seminiferous tubules, and in response, it develops and supports spermatogenesis and inhibits secretions. Next is puberty in males. So before we undergo to adult, before we undergo to adult, we reach first in the puberty. So what is puberty? So puberty is the sequence of events by which a child is transformed into a young adult. In boys, puberty commonly starts or begin between the ages of 12 and 14, and it is largely completed by the age of 18. So one of the hormones that is who influence the puberty stage is the GnRH, LH, and follicle stimulating hormones and testosterone. So before puberty, small amounts of testosterone secreted by the testes and the adrenal cortex. The beginning just before puberty, continuing throughout developmental changes in the hypothalamus, cause the hypothalamus and the anterior pituitary gland to become less sensitive. So the testosterone still has negative feedback effects on the hypothalamus and anterior pituitary gland, but the GnRH and luteinizing hormone and follicle stimulating hormone secretions occurs at substantially high levels. Next, let's proceed to the effects of testosterone, the major hormones of males. So first, testosterone is the major male hormone secreted by the testes. During puberty, testosterone causes the enlargement and differentiations of male genitals and reproductive duct systems. So it influences the enlargement and differentiations of male genitals because of the testosterone. And additionally, the testosterone influence also the secondary sexual characteristics. These are the structural and behavioral changes. Secondary sexual characteristics in males include hair distribution and growth, skin texture, body fat distribution, skeletal muscle growth, and changes in larynx. Also, deepening of the voice and changes in body composition or structure. Next is male sexual behavior and male sex act. So the male sex act consists of several reflexive steps. First is penile erection, secretion of mucus in the urethra. Emission is the movements of sperm and granular secretions into the urethra, while ejaculation is their forceful release of the outside. These processes are accompanied by pleasurable sensation, culminating in an orgasm. Afterwards, during the resolution phase, so when we say resolution phase, the penis becomes flaccid and the male experiences satisfactions, and a temporary period occur during which another erections and ejaculations cannot be achieved. Next, let's proceed to the sensory impulses and integrations. Sensory impulses from the genitals travels to the sacral spinal cord, where reflexes that control the male sex act are coordinated, while additional signals go to the brain to create conscious sexual sensations. Failure to achieve erections or erectile dysfunctions or ED, sometimes called impotence, can a major source of frustrations in some males. Some men can achieve erections such as sildenafil or Viagra, tadalafil or Cialis. Next is verdenafil or Levitra. So some men uses synthetic medicine which erect their penis. So next is infertility in males. So there are lots of factors that cause infertility in males. So infertility is a reduced or diminished fertility in males is a slow sperm count. If the sperm count drops to below 20 million sperm cell per millimeter, the male is usually sterile or incapability to produce an offspring. So even when the sperm cell count is normal, fertility can be reduced if sperm cell structure is abnormal, as occur due to the chromosomal abnormalities caused by genetic factors. Reduced sperm motility is also a factor, results in infertility. Major cause of reduced sperm cell motility is the presence of anti-sperm antibodies. So these anti-sperm antibodies reduced by the immune system to bend to sperm. In cases, fertility due to low sperm cell count or reduced motility, fertility can sometimes be achieved by collecting several ejaculations, concentrating the sperm cells, and inserting them into the female's reproductive tract, or also known